This is an anterior bilateral jaw dislocation that we're going to reduce using the classic technique.
Here's the brief anatomy review. That mandibular condyle has slid forward in front of the articular eminence, and it's stuck in that position. It's usually bilateral, so the motion that we're going to do in the classic technique is downward and posterior pressure. First, wrap up your thumbs in some gauze or tape so you don't get bit or cut during the reduction. With the patient relaxed or sedated, you're going to insert your thumbs into the patient's mouth, press down on the molars, and slide back posteriorly. She's using quite a bit of force. She's up on the bed, pressing hard, but constant steady pressure will also fatigue the muscles. And watch it slide in right about here. Now you can see why wrapping your thumbs is so important. In this case, there wasn't a big satisfying clunk, but Dr. Falsgraf, who performed the procedure, said that it slid in nice and smooth. While the patient was waking up, we put him in this modified Barton bandage to give him a little jaw support, really prevent him from yawning and dislocating again. And he definitely needs to follow up with OMFS.